Well, I think first it's certainly a big win for science. It's a big win for public health today. A lot of really great news coming out from the scientific community, and we need this. We need some good optimism. We need some good news, especially in light of all the bad news that's happening today and the worst forecasts that we're seeing in the months ahead. So I think first what we're hearing and what we're seeing is that this is promising news, but it's not the end all be all. And what I mean by that is while this is great and we know that there is a timeline that's being established in terms of when this vaccine may potentially be made available to the time that it's going to be in individuals' arms, there's still some time between now and then, which means that we have some very rough few months ahead of us. And so it's still the same preventative measures. I think one of the big challenges ahead of us is once we have the first and second generation of these vaccines made available, it's really the operationalizing, the administration and distribution of these vaccines where rubber meets the road is going to have a really significant impact. And there's going to be a lot of financial support needed to do that.
When do you think that is a realistic prospect then, talking about widespread distribution? What is your best guess?
As if and other vaccine companies have stated, we probably will have a vaccine made available sometime end of this year for the first priority groups, which is healthcare workers and those that are highest risk. But we're not going to see the general public actually have access to these vaccines, and we're not actually going to see the effectiveness of these vaccines played out in the general population until sometime Q2 of next year. So we still have some months to go. This is a process that is going to follow a pretty fast timeline, but certainly it's not fast enough with the coming months and the increased number of cases that we're seeing around the world.
So, Doctor, from where you sit, when you look at the data that's presented to you from your expertise, from where you sit, what appeals to you most about the vaccine? What do you like about it? What makes you think it's going to work?
Well, I think first at face value, hearing that 90% effective rate is a huge surprise, because for the FDA, they put the bar as at least 50% effective, and so this is 90%, which is really great news, because we know that not only is it important to have a safe and effective vaccine, but also when it comes to coverage of that vaccine, if the vaccine effectiveness is lower, then you're going to need to have more people in the population vaccinated to really have an impact on the pandemic. And given that it is at 90% and perhaps even higher once you have an actual vaccine made available to the public, then we know that you don't have to have a very large population to be vaccinated. So I think that at face value is very good news.